around 7 or 8 years ago, we had this idea to digitize data collection, grassroots data collection, at a time when the big data did not really exist as it did now. And so one of the things that I will talk about today was not only what GoShadow is as a company and then the actual product itself, but we are different, as especially some of you know on the call who have or are interning with us. We do not have outside funding and never have gone for outside funding. So in the startup world, we're often known as hustlers. So that is an art unto itself. And then in addition to that, being humble, right? So I've worked with many other startup or angel investors, venture investors, and none of them are very humble often. And so that is something that has been instilled in me through my experiences, personal and professional, and is, I think, very critical to being successful, not only in healthcare, but in teams in general. And so for today, I wanted to let me move all of your pictures here. Okay. So I recognize that all of you are in graduate or undergrad, graduate school, maybe thinking about going to graduate school. So there's this balance, there's a constant balance between the courses that you take and application of the work that you do in the real world. And so gaining practical experience and how you can do that is, I think, one of the most important ways that you can differentiate yourself and start to form your personal story that will enable you to get wherever you want to, right? It's all about your experiences form who you are professionally and personally, and will enable you to move forward, get jobs, move up in the jobs that you have, create your own startups, or just give meaning to your own lives. And I think especially right now, that is the biggest thing that anybody will tell you, is that they are looking in this current state of isolation and unknown and feeling of lack of power. We're all looking for some type of meaning and value in everything that we do, right? So the interactions that we have, professional and personal, how self-care, everything that you do, that all comes together and forms where you go as a person after school or in the future. And so you can't leave, sometimes it's very easy to just go from or to divorce your professional life and your personal life. And in reality, that is not it's not always so neat. And then I'll tell you a little bit about our vision and the idea of this concept of shadowing, which was not new at all, and was very common in the healthcare world and has many different names, and why we took that idea and built it out as a product unto itself, and then what the future brings. And then lastly, just knowing, my background, as I'll tell you, is in improvement, process improvement. And failing actually tells you more than succeeding does. And so you have to keep that in mind. That is the humility piece of all of this, and being honest with yourself. How you take failure or something that doesn't happen exactly the way that you expect it to, and make lemonade out of lemon, so to speak. It will speak volumes to your character and also enhance your story that you're able to tell in the future to whomever your audience is. So a little bit about me. I went to Wellesley College. I was a political science and Spanish double major. For those of you that are familiar with Wellesley, there's really no pre-professional programs even still. So I knew at the time that I wanted to focus on healthcare policy, but there was not any specific coursework to help me to do that. So I graduated with a liberal arts education, which, now in today's world, it's very hard because there are so many students like yourselves who have very specific training and expertise. But at the time, that helped me tremendously because I could write, I did tons and tons of presentations. I had an analytical background, and I had a bit of policy experience. And then in addition to that, I grew up in and around healthcare throughout people in my family, and so that helped me to solidify. I don't know exactly what I want to do, but I knew I wanted to gain in my first job out of college some type of experience that would enhance this these analytical skills and establish my vision for who I wanted to become and to the sort of team, I guess, that I would want to form around me or to be a part of. And so just by dumb luck, quite honestly, I had a meeting with one of my mentors at Wellesley, who is the head of the school, and she had said that her husband worked for Dana-Farber, which is a cancer institute in Boston. And many of you were probably not alive when this happened, but they gave a lethal dose of chemotherapy to a Boston Globe reporter in the 90s, and she died. And her husband was the either CEO or COO at the time. And it profoundly affected who he was as a person. It affected their marriage. It caused him to kind of withdraw from life and the healthcare world. And so she told me this incredibly powerful story and said, I want to introduce you to somebody whose goal is to prevent errors and to keep patients safe and to keep patients at the center of everything that we do, and to create policies and always events to actually enable that to happen. And so she introduced me to Don Berwick, who at the time was the head of the Institute for Healthcare Improvement. And by some stroke of luck, I was probably one of the only undergrads that they hired who didn't come from Northeastern, which is their feeder program for interns. And so the amazing thing about the Institute for Healthcare Improvement, and I'll go into this more, is that you'll see the picture, the blue shirts at the bottom left. They have a national forum every year. And with the exception of last year, it is an energizing experience where you see Don Berwick, whose vision is really enacted in the Institute for Healthcare Improvement, which is to provide safe, reliable, patient-centered care every time. He lives that and built the organization to have those exact same values and how they treated their own staff. And so every day coming to work, we'll talk about joy in work. Every day coming to work was a joy. Still to this day. And the reason I was late for this call is because I'm now faculty for them and doing coaching for nursing homes in a couple of different states around prevention of the spread of COVID-19. And to have meaning every day, having meaning and seeing the vision and being part of this amazing team really gave me the perspective and the energy to have a vision for myself, to take on risk, and then to eventually come up with GoShadow in its current form, and to iterate on hopefully what will become in the future. So in addition to being at the Institute for Healthcare Improvement, one of the things that they, or many organizations, I should say, like the Institute for Healthcare Improvement, who really keep their teams at the center of everything that they do, is they gave me permission to go on our very first Operation Walk Pittsburgh mission trip to Guatemala, which is the picture at the top of the original team that went. And that was in 2008. And what was so valuable was that, I'd never had clinical experience. And I imagine that many of you have had some clinical experience in some way, shape, or form. And I would just encourage you, to, if you plan on working in healthcare, even if it's especially if it's in leadership in the future, gaining some type of hands-on patient related or staff related experience is invaluable. You are able to speak the same language of people who are doing this work day in and day out. You are able to get them to trust you, get them to listen to you, and understand what really motivates them so that you can enact change or take what they do and scale it if it works really well. And so over the course of, Operation Walk has been around since 2008. I've been very involved. I actually left the Institute for Healthcare Improvement because I wanted to get more involved with Operation Walk in more direct patient care. So I moved back to Pittsburgh. And then in addition to that, shortly thereafter, we started GoShadow, which really combined both my work at IHI with Operation Walk in terms of helping those at the grassroots, right? Knowing what matters to them, helping them, meeting them where they are, and then making sure that their lives are valuable, meaningful, and that they have everything that they need in order to be successful. So let's go here. So I mentioned a couple of my time at IHI was, and still it was and is incredibly valuable. My team there, I left over 10 years ago, and my team and my roommates from there are truly some of my best friends still to this day. And a few of the things that they really instilled in me are here. So understanding what motivates people, right? And what motivates you. When you look for, I imagine that many of you are looking for jobs or thinking about going to grad school. This is a really critical piece of understanding where you want to go, right? How are you going to build your story, your personal story, your professional story? They also were very good, and the senior leaders were able to have all of us share in their shared purpose, right? So and even though we worked directly with frontline staff and didn't necessarily work with patients, having this shared purpose of acting as a team in order to transform healthcare worldwide, every day when you came to work, that was front and center. The workplace and all the decisions that were made at the workplace really reinforced that, which I think was an incredible experience to have when you walk into an office every day. In addition to that, mentorship. I'm sure that all of you, this is a key point for all of you. Mentorship is invaluable, right? And it doesn't have to be a senior leader or somebody that is, high up within an organization, so to speak, but somebody who understands you and your goals and who has the time actually to speak with you on a regular basis. Those are the keys for, to have a good mentor-mentee relationship. I know of many senior leaders who offer to be mentors but don't have the time to do so, and it does not work out well for the mentee, and is often a very frustrating experience. So that is something that I would encourage you to think as you, in every experience that you have, right? Who are you going to leave that experience, and who are you going to keep in touch with? Who would you call your mentor so that you can go back to them, ask them for advice, ask them to help you, have those honest conversations. That's a key at this phase in your life, to think about who those people are and how to communicate with them and form a lasting relationship with them. In addition to that, one of the key tenets of IHI, and I would say growing professionally in your, this phase in your life, is figuring out how to take on risk and new opportunities, but not too much. So you want to grow, you want to add to the stories that you have and the experiences that you have, so that when you go into interviews and someone asks you a question, you have something right off the top of your head that you can say, yes, let me tell you where I failed, or ways that I succeed in very specific ways. And here they are, right? So taking on risk and being okay with failing, right? Because you know that failure you will learn a tremendous amount from. So figuring out where you're comfortable taking on risk and new opportunities and charting a new path in your own personal and professional life is a key thing to do right now. And then in addition to that, being part of a team is something that you, in every opportunity, every place in your life, you will be part of a team. And so I can imagine that there is a lot of competition for jobs and for, within workplaces to ways that you're constantly looking to distinguish yourself. But the key is to recognize that you can't be successful as an individual in most scenarios. And that anybody who is a true leader will reinforce that they didn't get there by themselves, right? I rely on many, many people in order to, just get through a day's work, let alone be successful in doing that. And so you have to form and pick people who are part of your team and your foundation in your life right now that bring you joy, that provide you with risks and opportunities to grow, who do mentor you, and more than anything, who share the same purpose that you do. And are motivated by the same things. So after I left IHI, I moved back to Pittsburgh, which is where I'm originally from. IHI is located in Boston. And I will say that the transition back to going home was, I never anticipated to be more permanent. But again, you have to be open to what comes at you over the years and in life, because you can't, I guarantee that if you have everything charted out on a piece of paper or anything else, you will deviate from that, and that's okay. I think being open to change and open to new experiences and opportunities will only help you to grow in the future, and help you to take on risk and to differentiate yourself from others around you, and to form this team of varied experiences. So, in terms of my background, right? So I went to this liberal arts school, had no pre-professional health programs at all. I worked at essentially a think tank whose lofty goal was to improve healthcare worldwide. I gained a ton of experience there. I helped to start their internal process improvement mechanisms for staff and staff training. And then I decided to completely pivot and move back to Pittsburgh and to work in the Bone and Joint Center, which is an orthopedic practice that's at McGee. And I had zero clinical knowledge. And I quickly went from helping them in their Medicare CJR program, which was a mandatory program that Southwestern Pennsylvania was a part of, to look at the true cost of doing a knee and hip replacement. Which was my original goal in moving back there, right, was to create this pilot program for templating what a knee or hip replacement costs, exporting that, working with Medicare on getting into the weeds of what that looks like policy-wise, and then hopefully spreading that to other places. And that was what I had done in IHI, and I was very, very comfortable doing that. And then from there, my experience, what I ended up taking on was managing the clinical practices of 4 surgeons, and 20 to 25 staff members, from, advanced practice providers all the way down to, front office staff, patients on a daily basis, answering phones, doing just about everything under the sun. And so it really couldn't have been more different from the job that I left in Boston. And there were, I will say that working with patients and working with the public provides a whole other set of challenges and benefits at the same time. And so going back to wanting a purpose and to ensure that knowing that every opportunity and every experience that I had would enable me to grow. One of the things that I really wanted to focus on was how to make care more patient-centered, right? So in the orthopedic world, especially in Southwestern Pennsylvania, there's lots of opportunities for patients to choose different programs. McGee is one of many, many high volume programs. And really medicine has never been consumer driven, especially orthopedics, right? And programs that are largely run by Medicare because they're not incentivized to. And so one of the goals was how to create this great experience for patients throughout a 90-day pathway that could be when they first come into the office and end with when they have surgery. And so what's interesting is that was not something that had really entered into my mind when I had started there, right? I thought I was going to be running their internal improvement and this Medicare bundling initiative. And I ended up looking at the entire pathway and figuring out ways to make it more patient-centric. And the benefits of doing that were that many, many times the healthcare can have there's people who are not big personalities, I guess is a good way of saying that. And so figuring out how to bring them around to the fact that being patient-centered is not only better for their outcomes, but it's better for their bottom line. Patients will want to come back to them. They will give them positive Press Ganey and HCAP scores if they feel like their voice is valued in this whole process. And by the same token, staff in the same way have constantly wanted their voice to be heard and to feel a part of and truly be a part of this team-based approach, which was really still new in healthcare. It was this transition from having this, instead of the patient being at the center of care, most oftentimes the physician was at the center of care and everybody was being dictated to them outwards from the physician. And so this was really a momentous change. And at the same time, combining all of process improvement with these things enabled us to be able to think back. And I say us because we had a team. I worked with a team that was part of UPMC at the Innovation Center. I worked with my former colleagues from IHI. And then on the clinical side, I worked with many of the physicians to enact these, the regulatory requirements, making processes more patient-centered, and then also teaching staff how to have greater control and how to communicate with each other and with patients. And so from there, I was really able to draw in my previous experience from IHI and thought to myself, there has to be a better way to do this. And so hence GoShadow was born. At first as a purely process mapping, instead of what used to happen and what I used to coach people to do at IHI is to follow patients or to follow nurses to do process mapping or spaghetti diagrams or journey mapping. It has tons and tons of different names. To do this on pen and paper and to carry around the stopwatch and pen and paper and to write down timestamps and notes for every time a nurse would go in and out of a room, or to follow a patient through an outpatient office visit or the operating room. And at the point where on the clinical side, there was no appetite to do this. It took a ton of time. It was difficult to take notes that were handwritten on a piece of paper and do anything with them when you're a clinician, and that is not something that is usually part of your day-to-day basis or any workload or anything that you do. And then on top of that, there was no meaningful data that was derived from there other than reinforcing what oftentimes staff knew already were inefficient processes or things that should have been improved systematically. And so there is this, what became the challenge is how to turn this tool, right? This tool and process into something that was transformative in terms of how people thought about doing their work and how they thought about interacting with patients. And so the What Matters framework came later, but really the goal is to be able to co-design any process at any time, and this doesn't necessarily just have to be in healthcare, with all of your end users, and to engage them in that process iteratively and continuously, right? So on the calls that I am on right now, that oftentimes the question comes up, well, we have all these regulations, we're just going to do these regulations, we're just going to do what CMS tells us to do, or do what the CDC tells us to do. And I think that's fine and good, and everybody knows that there are lots of regulatory bodies out there that hospitals and nursing homes and everybody is beholden to. The key with this process and co-design tools, of which shadowing and asking open-ended qualitative what matters like questions are, is that they are able to actually provide meaning for those who are on the front lines, to operationalize all of the rules that come from on high down to them. And it enables them to feel and to actually have greater control over their day-to-day lives, their care, their outcomes, how they work in the team, giving them a mission and feeling invested in a team and invested in their job. And so this is something that is really transformative, not just for patients, but also for caregivers, especially for caregivers right now. And so as we built out GoShadow as a tool, a lot of people, this isn't sexy, right? Like a lot of, this isn't Uber or anything that's super sexy. The app that we developed is very rudimentary in the sense that it tracks time in terms of where you are, who you're with, and what you're doing, and creates reports. It's nothing that is, super specific or, going to, bring you food or anything like that. The value in doing it is that it sits within this larger structure of co-design and enables us to be able to operationalize data at the front lines and to empower those whose voices are often underheard. And Micah, I'll echo, I don't want to talk for this whole time. So I've been talking since noon this morning or this afternoon. So if any of you do have questions, please feel free to chime in anytime. And so I brought up this picture because we had our beta GoShadow was, in terms of speaking from a startup point, there was nothing. This has been custom from the get-go, right? And I don't have a dev background. And so we were quite literally making things up as we were going. And I was drawing things on pieces of paper saying, wouldn't it be nice if a report added all of this data? Or wouldn't it be nice if it did X, Y, and Z? And sometimes it worked and sometimes it didn't. One of the things that we learned very early on is to don't go past beta until you know that the tool has really been pounded on and user tested. And that's something that I think is you only can do by taking time and being methodical and having a process in place for QAing any type of product. We didn't do this at first, and there was a tremendous and is a tremendous need because there were so many organizations worldwide that were doing, the economy was strong, people's QA or quality improvement departments were huge. So they had the capacity to do tons and tons of projects that they needed this data for. And so I had my connections from IHI, and going to a little too fast was one of the first things that we did. And it was problematic, right? Because when things break, people don't understand why they break and why it hasn't been tested, or what the term, bugs. People didn't understand, especially in the healthcare world. When you say that the program was buggy, they would quite literally think that there were bugs somewhere. So figuring out and balancing the dev side with your vision of what your tool is, and then practically testing that iteratively, constantly, always with a group of testers who know that they are testing a product that is new, that it is, we're willing to improve it, but that it is completely custom, and that we actually need their feedback in order to move forward, was something that we had to take a step back to do very early on, because we had gone a little bit too fast, too quickly. And again, this goes back to the fact that because we were never looking for outside funding, right? We never wanted to get caught in the funding trap of once you start trying to raise money, you are constantly in the raising money world, and can't actually focus on your product or vision for the product. You lose control over that. And that was not where I wanted to be, and not where I still don't want to be there. And so I think, there's two different pathways, and we can kind of talk about that if that's of interest to you all later. But I am obviously more biased in the hustle world, and have chosen that path rather than the raising money world. Sure. So Nathan said, I find that many leaders are using more reporting functions in the form of dashboards. Can you talk a little bit about your experience with dashboards and the power of visualizations with business intelligence? Absolutely. So we're going to do that a little bit at the end. And actually, I'll let some others on the call on them to talk about that as well, because that is our long-term vision. So again, GoShadow as a tool, right, sits within this framework, which is really methodology. So one of the challenges with this is that you're trying to bring people along with you to motivate them to think about how they do work differently. And this is often it's like building a campaign, right? So what you have to find what motivates people, you have to get them to do it. You have to get them to think that the world is larger than just them. And some people have no interest in that, to be quite honest with you. And others latch onto it and say, this is the right thing to do for our patients. This is the right thing to do for our staff. It delivers better clinical outcomes, and we're more efficient. And so we all, especially in healthcare, you constantly have to go back to the fact that this is part of a larger process, which is the design science, which is based here in Pittsburgh, actually. There's been many programs, and there's a huge international community around design and experience-based tools in healthcare that we're constantly having to fall back on to say, we're not making this up. This is a real thing, right? And so what we're trying to do is just to create a suite of products and tools that enable you to get better clinical outcomes, to be more efficient, to engage your staff and to your patients, and to apply these concepts, which seem very theoretical, but are very, very simple at their core. And so building a movement is the first part of this, right? So this isn't it, everything is iterative, right? So when I worked at IHI, I was trained in their model for improvement, and it's like Lean and Six Sigma and anything else. this plan, do, study, act, right? Everything is cyclical. And so you have to, part of the movement and building this movement is figuring out how to motivate people. And this could be true of you right now, right? How do you manage up with your, if you're going into the workforce, how do you manage up to with your supervisor? How do you get them to see your point of view and get them to listen to you? And so this is where the asking what matters, and this same framework again has been, there's a famous professor who helped with former President Obama's campaign. His name is Marshall Gans, and this is what his research is all about. It's in intrinsic motivation and how to get an individual to take the leap to be part of a campaign or a team or something that's much larger to them, and how to get them to do it right now. And so I don't have all of the answers, as we very much practice what we preach, and this is all iterative, and we are learning sometimes faster than we can keep up with. But asking what matters now at any given moment, it seems to be a way over the last year that there is a tool and a method by which that is this very simple asking people and empowering them, giving them a voice and asking them what matters, that the data harvested from that, you can create dashboards from it. You can, stratify it and correlate it to, how they would recommend a hospital or how they would recommend working in an organization. But more than anything, the responses that people give to this simple question allows them to find shared value and meaning. Many people, when you ask them what matters, and I was trying to find photos from Operation Walk. We did this on Operation Walk in English and in Spanish. People wrote the exact same thing in different languages, right? What matters to them were their family, their kids, their pets, feeling safe, feeling valued, all of these things. When we did this very simply on Postit notes, right? And so there's lots of people, what you think about doing this on Operation Walk when you're talking with the poorest of poor patients. The people that work there are also by our standards very poor, and so being able to have this shared meaning with them is incredibly valuable when you don't even speak the same language. But more than anything, when you have this shared meaning and shared value, what do you do with it, right? So you have to figure out a way to deliver this sense of urgency to move towards a common endpoint. And that could just be, enacting what matters. But that is something that this driving sense of urgency, and for you all in your future lives, when you manage up, figuring out how to get your voice across and to use powerful language like I, right? Or a team that says we, and reinforcing that with shared values and meaning. I think that will enable you to drive change within your organizations, should you desire.
Hey, Ange, sorry to interrupt, but I just want to give you a 2-minute warning so that way we have time for questions at the end.
This is way long. Well, okay. So what's interesting, and then I'll show you some of the visualizations, because I know that this is probably more of interest to you, and I want you to ask questions. So the experience-based co-design I mentioned is a science. There's lots of papers around there based on experience-based co-design, but GoShadow really sits in shadowing as a process, sits within this experience-based co-design framework, as well as asking open-ended questions and using motivational interviewing. And oftentimes people kind of debunk it or want to debunk it as being soft. But interestingly, the data all says that when you do very simple things like asking patients, build empathy with staff, asking them all what matters to them, to understand your stakeholder's voice, and enables you to drive change forward and to build teams that produce lasting products that make the end users happy. And that is because, not surprisingly, the end users are engaged in their design, co-design, and iterative improvement. So it's a bit of, somebody who is a very good leader is able to organize and to bring people together to motivate them to act in a forward direction. And so this phase, and I'll share, I think I shared all these slides already. I want to find the slide of the Post-it notes from Operation Walk, but GoShadow right now, again, there's people still do this on pen and paper, I should say, right? So we've kind of stepped away from the fact that technology has to be the tool for everything, because it's not. And in fact, for some people out there, especially in the healthcare world, they're very slow to evolve, and they are adverse to using their phone because it takes them away from what is directly in front of them. And so our iterative challenge has been figuring out what matters to our end users. And so we've developed lots of tools and visuals to do this, we still are honing. And then we constantly train people on why this is important, right? And that it can't just be a one-time opportunity, but it has to be a culture and the way that you do business in order to be successful. And then in terms of the benefits, there's constant benefits to, I'll just think about reduce readmission rate, right? This is asking what matters and understanding and walking in the shoes of patients who have congestive heart failure, COPD, who are oftentimes the highest readmission rate patients in the country, if not the world, when you ask them what matters, their readmission rates plummet. And it's because you understand what motivates them, and you're then able to deliver care that addresses exactly what they want. So for example, somebody on a call today, and then I'll close out, is that somebody said on a call what they asked a CHF patient what mattered to them most, and they wanted to be able to go to church, and they wanted to be able to wear their sandals. And one of the biggest reasons why salt is a problem for congestive heart failure patients, right? So they swell and they have edema. So she couldn't put her shoes on, which was devastating to her. So knowing that that's what mattered to her, the care team was able to come together with her and say, okay, well, this is your goal. If your goal is to be able to wear your sandals, let's work backwards and figure out how we can get you to be able to do that. And she then saw that when she consumed less salt, she was able to slowly get her foot into her sandals and eventually go to church. And again, so this is story, right? This is a patient story, but this is you're building will and ideas to then execute on a problem. In terms of the visualizations, let me go a little bit further. So what we've always tried to do is combine, there can be standardized visualizations of dashboards. So for example, we have templates for data collection in outpatient office visits, in ORs, in just about any, inpatient practice, inpatient facilities. You can build what this, the framework is of what that patient experience is. And I can tell you with great certainty what those segments of care are, right? So the key is, how do you contextualize all of that? So for example, the waiting time in this scenario, are spending 23 minutes in the registration or waiting room. How do you contextualize that 23 minutes, right? Is the patient having a good experience? Is somebody having a personal conversation with them? Are they just sitting there waiting, not knowing what's happening next? And so the goal with GoShadow has always been to give context to the data that oftentimes can be collected in EMRs through clicks, but it can never be contextualize to say 23 minutes is good, 23 minutes is bad, or maybe it's neutral. And so that's been a key. And I think one of the dashboards are awesome, and they're very powerful tools, but contextualizing them at a human level is something that I think there's still a ways to go on. This is, speaking of kind of dashboards, asking what matters. We aggregate, and Micah spent much of last summer, and Hannah DeGraff does as well now, in aggregating this qualitative data to create dashboards. And so these domains that are here on the right, support, communication, and safety, we took those from the Team Steps Guide. So we take validated literature and then apply it to and modernize it for today, and humanize it in the way that data tells a story, right? So you can see very easily through the word cloud on the right, these are the words that people actually use. So what's gone well, right? The larger the text, the more it appeared. And so these visuals are helpful when contextualizing purely numeric data, and I think are very much needed. And qualitative data tagging, and I will be the first to say that we are iterating and making up the rules as we go, so that the value to our end users and to our clients is there. But you can see the domains have expanded, and then we have positive or negative in terms of the comment being positive or negative as it rolls up to, say, staffing or supplies or education. And so these dashboards, I've seen tons and tons of dashboards for quality metrics. And sometimes for things like quality metrics or readmissions, it can be very straightforward. But then for these human side and process improvement, I think that it's not as simple as just looking at call off days or just looking at time spent at the bedside. You have to contextualize that and understand why, and do a root cause analysis and ask the end users, was that good or was that bad? We don't know, right? For most non-clinical measures. And so that's our goal, as well as to build meaningful process maps to help people understand to how to get to where they want to go. So I'm going to stop sharing there, because you can see these later. What questions do you have? And I guess I should also have backed up a step in saying, because I see that there's a lot of women on the call that they're balancing and for everybody, balancing work and life and family can be challenging, and sometimes there is no balance, or not a great balance. But making sure that you work within a team that I think respects your time and your vision for your personal what your personal values are and your family life is critical. I know a couple of you have met my kids, who are became part of our project this summer with partners in the UK. But that's a really key step, in people who keep you honest, I'll say too. So thank you so much for having me. I didn't think that I had enough to talk about at first, but obviously I did.
Yeah, thank you so much, Ange, for coming and speaking. And if anyone has any questions, we could always email them to Ange to answer, and then I could send them all out.
Yeah, that's completely fine. I mean, we could talk. One thing that might be interesting for maybe you and Hannah to talk about is like what you're doing right now with regards to dashboard creation and data tagging. Not to put you on the spot, but
I think that's all Hannah.
Well, Ange kind of went over it a little bit with looking at the different dashboards. So I look at all the different surveys that come in from the different hospitals, and I look at their qualitative data, and I'll read through it. And we are trying to create a Python program or a machine learning type of program, so it will read through it for us and theme it for us. But that's still in the making. So I am looking at it, reading through it, and will theme it based on kind of what I think it is going to be like and whether the sentiment is positive or negative. And then I'll put it into a graph. And then I'll do that for a bunch of other qualitative data points. And I'll put it in a slide deck, which then Ange presents to all the different stakeholders.
Or Micah does too. Micah was, just to give you kind of a little bit of context, right? So people, this qualitative data, there's lots of even Pittsburgh-based startups who qualitative data analysis is a kind of like the holy grail right now in machine learning. So knowing that, we started, and Micah started this summer and then the spring, building the groundwork by hand, and we have a couple of huge sets of surveys and data that have enabled us to hopefully provide more meaning and make it more easy in the future to be done. But it's just an example of something, like Micah will agree, we made this up as we were going along with the client, which was a huge hospital system in the UK, and they love it. And I think being honest and not trying to kind of oversell what we're delivering to them is a key in anything that you do, in terms of just being honest.
Yeah, I definitely would agree with that. I would say like the need for Hannah's project came from like the work we did in the summer, and it was just a massive project to work on. And like Hannah said, we were reading through like qualitative data and trying to make sure we were grabbing all the like important data points to show the stakeholders. And so just finding a better way and a more systematic in an algorithm is what like they're working on now and what we're all working on. So I'm definitely grateful for GoShadow and the cool work we always do.
I want to let everybody go because I know you're.
Yeah, that is, well, thank you, Ange, for coming.
Thank you.
And speaking. And Kim, I think you're muted.
That's okay. I read her lips.
Oh. Thank you so much. It was really, really, really interesting, and we really appreciate it.
Well,
and
thank
I think
you.
We'll have students in the future coming to you, maybe for internships or any type of, experience if you desire.
I think we work with other, and Micah's worked with other grad school students who are come more through the resident program. And one of the things that I can say that we're a little bit unique is that you can do anything from like what Micah and Hannah are doing to, in non-COVID times, actually shadowing patients and getting more direct patient experience or administrative experience. So we love having interns and learning from them as well.
That's wonderful. Thank you so much.
Thank you.
And thank you everyone for joining, and look out for future emails from us. Bye.
Very good.
Bye. Thank you.
All right. Bye-bye.